Hello listeners, welcome to Views on Health. Tonight on the program is Dr. Sivayoganathan Premananda, consultant eye surgeon at the University Hospital of the Kottalavala Defence University. I'm sure listeners will recall that we had Dr. Premananda speak on glaucoma last time around, but tonight the focus is on diabetic retinopathy. Without any further ado, over to you, Doctor, to introduce the topic.
Okay, thank you so much. Thanks again for another opportunity. So, diabetes is actually one of the diseases which may affect the eye, and that is, diabetes actually affects the eye very commonly than any other disease. Diabetes can affect the eye in many ways. Even it can affect the lid, lenses. Even diabetes can lead to cataract, and also the most important thing is the retinopathy. There is a sort of a layer behind the eye which has nerve cells on it. We call it retina. So diabetes can affect the retina. So that is the most important thing. This is very common. Especially nowadays, it's very common because people are unable to afford medication for diabetes, though it is available in the government sector. Some of the medication they may need to buy it outside. So the diabetic retinopathy is on the rise. It is very important for the listeners to understand what is diabetic retinopathy and how we could prevent that. So basically, there are various reasons for the diabetes to affect the eye. The age is one of the important thing. The other one is type of diabetes. There are various types, and type of diabetes is one of the important thing. Other one is duration of diabetes. There are other diseases which may associate with the diabetes, and it may increase the diabetic retinopathy, like hypertension. Hypertension means blood pressure, the cholesterol or the lipid levels in the body, and also pregnancy. Pregnancy also might increase the diabetic retinopathy. And if there is less hemoglobin, we call it anemia. Anemia is also one of the problem. And also smoking, lack of exercise, all can lead to diabetic retinopathy. So, only way for them to identify diabetic retinopathy at the early stages, again, screening for diabetic retinopathy. Usually, the primary care physician or the physicians, they refer the patients to us to screen for diabetes. That is a regular thing. So, each and every patient should be screened for diabetic retinopathy.
So, Doctor, from our perspective, once diabetes sets in the system, there's no reversal.
Yeah.
You have to take care of it. You have to take care of your health.
That's right.
Your medication, your lifestyle, and your food, all of that to control the diabetes.
Yes.
So, can I just assume from a lay perspective, if a person with diabetes takes care of himself or herself, the diabetes is controlled, then the chances of it leading to affect the retina and to the retinopathy, as you call it in medical terms, we can be minimized.
Definitely. So you can minimize the chances of diabetic retinopathy by controlling the diabetes. So that is the most important thing to be done. So if you control the diabetes up to the level, then there is a very less chance for anyone to get diabetic retinopathy. If someone gets, if we see diabetic retinopathy in the eye, then we are sure that the patient's diabetic control is not at all good. Usually, if the control is very good, then very unlikely a person is getting a diabetic retinopathy. So people do think that if they don't eat rice or sugar, they don't get diabetic retinopathy. So they think that their diabetic control is good with if they don't eat rice or sugar. but it's not the case. They have to actually know about their food very well, other than the rice and sugar. They have to know about their food very well, and they have to know how much they can eat, how frequently they have to eat, how they have to take food, how much calorie they need. They can get these informations actually from the hospital clinics. Usually in the hospitals there are places where they give nutrition advice. If they don't have this knowledge, they can actually approach them to get this knowledge, so they can modify their food habits. And also the other thing is exercise. Exercise also important to maintain the health. So they can gather all this information, and they have to modify their food to improve their diabetic control. So if we see diabetic retinopathy, if they don't control the diabetes, it's very difficult to control the disease. Diabetic retinopathy will progress if their diabetic control is not good. Even though we do various treatment, even though we administer injection or whatever, it's going to progress if their diabetic control is not good. The other important thing is, when this is the only place, eye is the only place you can directly see the damage in the blood vessels inside the eye. When that happens, in the other parts of the body also this would happen. For example, in the kidney, kidney also will get some blood vessels damage by the time the eye simultaneously having this sort of changes. So if we see a patient with diabetic changes in the eye, we always tell them to go and screen the other parts of the body, including the kidneys and other things. So it is very important for them to screen for diabetic retinopathy and controlling the diabetes.
So doctor, once it sets in, what happens?
So at the early stages, it's not going to affect the vision at the early stages. So diabetic retinopathy, actually at the beginning, it's going to affect the blood vessels on the retina. So after with time, the blood vessels are going to be leaky. Whatever the fluid inside the blood vessels it's going to come out into the retina. Retina is going to swell up, and there may be bleeding in the retina, and the protein and the lipid inside the blood vessels, that is in the blood, is going to come out and into the retina. So it will lead to more swelling. So at the early stages, it's not going to affect the vision, but with time, in the later stages, it's going to affect the vision. So the patient's vision will gradually go down. If we catch it early, we can advise the patient about diabetes and diabetic retinopathy, and we refer the patients to primary care physician for them to optimize the diabetic control. Then we can stop the progression. Even disease changes may revert back to normal level, but after a certain stage it's not going to happen. So even though we do treatment, even though they control their diabetes, the remaining residual changes and the disease may stay there until their later stages in their life.
So doctor, this is not a rosy picture.
Yeah.
So it affects the vision, and then it will have, of course, very serious consequences.
Yeah.
Now, diabetes is something that affects even younger people today.
Yeah.
Unlike in the past.
Yes.
From what I've gathered, it's set to become the number one killer disease in time to come, even overtaking ischemic heart disease, is what
the
predictions are there.
Yeah. So, basically, ischemic heart disease, one of the reason for ischemic heart disease is uncontrolled diabetes. One of the important reason for ischemic heart disease. So, yeah, diabetes actually can affect any part of the body. So it may affect any part of the body, including the eye. So if we don't control diabetes adequately, any part in the body may get affected, and including they might get heart attacks and things. The important thing is to control the diabetes. Easy way is to modify their lifestyle, improve the dietary pattern, and also doing exercise. No smoking. Always say no for smoking. Those are the easy way to control the diabetes. And the other thing, important thing is, if a person is obese, then there's a high chance of diabetes. So especially in children, childhood obesity, increased weight, so that should be avoided. So the younger generation these days, actually the outdoor time, actually they don't do much sports, they don't play enough. Most of the younger people, the children, they stay with the digital screen like phone or laptop or palm top or whatever. So playing is important, outdoor sports or whatever, even that is very important.
So doctor, how do you treat diabetic retinopathy?
Again, it depends on the stage.
Of course, yes.
Yeah. So early stages, actually we don't need any treatment. If their vision is normal, we don't need to treat them. We actually give advice and we refer the patient to the primary care physician to improve the diabetic control and diabetes. But if there is swelling behind the eye, then it depends on the site of swelling. We may need to give injections into the eye to improve the swelling, or we may go for laser. It depends on the clinical feature. It depends on the clinical features. We decide whether to go for injection or laser. And with the diabetes, some people do get abnormal vessels, abnormally grown new vessels inside the eye. In that case, we have to go for laser therapy to the patients. Actually, we burn part of the retina to reduce the newly grown abnormal vessels inside the eye. Otherwise, it may bleed and fill the eye with blood. So if that happens, then it's very difficult to treat the patient. So we have to stop that. So we burn the retina, part of the retina, to do that. But if we burn, their vision is going to be less. The retina we burn is actually the part of the retina we burn is responsible for the surrounding peripheral vision. So these patients, after laser, their surrounding vision, peripheral vision, is going to be less. So we advise them not to drive, because it's difficult for them to drive after burning the retina. Whatever it is, the important thing the listeners should understand is the diabetic control. Without the diabetic control, we can't achieve optimal result in patients. So diabetic control is the most important thing they have to do.
Though our focus is diabetic retinopathy,
yes.
If a person doesn't have diabetes, can their retina still be affected in any other way?
No diabetes.
Yes, a person without diabetes.
No, absolutely no. If there are many other diseases which can affect the eye, but in a normal person, retina is not going to be affected without any issue.
So that is comforting to know that if you're not diabetic, your retina is going to be safe as well.
Definitely. Their retina is going to be absolutely safe. But blood pressure and things may affect the retina in different ways. But usually diabetes is the most important disease which may affect the retina very commonly. And people do undergrade it, underrated it. And other thing is, what I usually tell the patient is, usually patient comes to us in the late stages of the disease, in late stages of diabetic retinopathy, and they ask whether they can bring the vision back. But the simple answer is, actually if you prepare some food and if you keep it on the table for some time, the food is going to be not good, spoiled. So if you keep the food inside the fridge after that, the spoiled food is spoiled food. You can't do anything. That is similar to the eye disease also. If you leave it for some time with the disease, and if it spoil your eye, it is spoiled forever. So you can't do anything after that. Whatever the vision goes away, it goes away.
Lost is lost.
Lost is lost.
Cannot be retrieved at all.
At the early stages, yes.
Yes, but later on, yes.
Sometime, it's very difficult to bring the vision back. We can bring the vision back, a little improvement may be there, but in the later stages of diabetic retinopathy, we can't bring back the normal vision usually. So
this is actually related not to one's age, but the condition of one's diabetes.
Yes.
Because young people have it, middle-aged people have it, the older people have it, all have diabetes in various stages.
Yeah.
Those who are affected, by diabetes. But irrespective of their age, if their diabetes is not controlled, it leads to it no matter how young or old you are.
Yeah, definitely it's going to affect the eye. And younger people, they have to be very careful because they have to live a longer time. So if they are not going to control the diabetes, then it's definitely going to hit the eye. Once it's there, then its life is going to be terrible. So always make sure that, especially the younger people, they have to make sure that their diabetic control is good. So otherwise they will they would go through a very hard life after that.
So doctor, once you treat, obviously you do your best to retain the maximum vision.
Yeah.
But beyond that you can't do anything. So what is lost, as you said.
Yeah, in the early stages, of course, we can bring the vision back.
Yes.
Otherwise, it's very difficult. If they come to a stage where there is abnormal blood vessels, abnormally grown blood vessels inside the eye, then there will be a definitive drawback in the vision. So we have to go for treatment. Treatment itself may reduce the vision.
Is this a painful process? In the sense that there will be a lot of discomfort to the patient because it deals with very sensitive parts of the eye. Yeah,
so what we do is I already told you that we burn the retina. Some people do feel a lot of pain while we are doing that. In that case, sometimes we may need to give some anesthetic, local anesthesia to bring down the pain before we do lasers. But usually we don't need to. We try our best to reduce the pain, but some people do feel a lot of pain. Other thing is diabetic retinopathy itself is not going to cause any pain. But in the later stages, because of diabetic retinopathy, they may develop high eye pressures. We call it neovascular glaucoma. So high eye pressures, that is painful. Because the eye pressure goes up, very, very high eye pressure, that will lead to very painful eyes. And in that stage, it's very difficult for us to bring the vision back. Usually the patient go blind with that in that situation.
So do you prescribe medication for eye pressure to bring it down? So like in a normal high blood pressure of a patient?
Yeah. Usually, as I told you earlier, most important thing is to control the diabetes first. Second thing, we do lasers and we give various injections to reduce the diabetic changes inside the eye, or improve the diabetic changes inside the eye, and also we give medication to bring down the eye pressure. But usually with the medication, it's not going to be controlled. It's extremely difficult to bring the eye pressure back to normal in that particular stage. We call it neovascular glaucoma. So in that case, we may sometimes, most of the time, we may need to go for surgery to bring down the eye pressure. Even surgery is difficult in those patients due to various reasons. Surgery also may fail most of the time. So I advise not to get to that stage. Rather than, it's easy for us to control everything before we get to that stage.
So there is a constant monitoring in terms of attending clinics periodically. You say, come back on this date. they should do that?
Yes. If there is no diabetic retinopathy, if a person is diabetic, and if there is no diabetic retinopathy in the first screening, if they come to the clinic annually, that is enough. The other people, if they have diabetic retinopathy, then the eye surgeon would advise when to come again. So if they follow that, that is adequately enough, provided their diabetic control is good. If we tell them come in 6 months' time, and if they don't follow the diabetic say clinics, or if they don't get the medication in the right time, then they may spoil their eyes.
So comes back to compliance.
Yeah, compliance is again.
You spoke of the last time around as well.
Compliance is very important. They have to take their medication in the correct time, and they have to compliance and say they have to. Diabetic treatment is lifelong usually, so they have to be on medication throughout their life. Otherwise, they are going to spoil their eyes. Not only eyes, their body basically.
Doctor, your take-home message.
Yeah, once again, the important thing in diabetes is screening their eyes. Usually, their physicians, they refer them to eye surgeons to screen their eye. After screening, the eye surgeon would tell them when to come again for the next screening or next clinical examination. So follow that, then you don't end up in problematic eyes. That's it. So basically, they have to screen for eye problem for diabetes.
Thank you, Doctor. And with that, we end this interesting discussion on diabetic retinopathy. We place on record once again our grateful thanks to Dr. Sivayoganathan Premananda, consultant eye surgeon at the University Hospital, Kothalawala Defence University, for sparing your valuable time to be with us on the program. Thank you, Doctor.
Thank you so much. Thank you.
We truly appreciate it. Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday same time on Views on Health.